lifting weights make women bulky? I get this question all the time. In recent years, it's become more trendy for women to hit the gym and lift weights, just like men. But women are still dubious of trying it out because for a long time we were told that to lift little weights because we shouldn't get bulky. But that's actually just a myth. Women can lift heavier and challenge themselves in the gym without it making them look too bulky. Yes, I know there are plenty images online which will show you women as bulky bodybuilders, but that's probably a picture of someone who's specifically trained to have that body composition. It's not an automatic result. The truth is, in order to build bulky muscles, you have to have the right conditions, and two of those conditions are based on hormones and food. Men find it easier to bulk their frame because they have a hormone called testosterone, the male sex hormone, which encourages muscle growth. Women do have small amounts of testosterone in their body, but not to the degree that men have. And it's partly the reason why women find it difficult to put on muscle mass. The second largest contributing factor is diet. To build strong, bulky muscles, you must fuel your muscles with food. Folks who are looking to put on muscle bulk go through a period of what they call bulking, where they eat large amounts of food to grow their underlying muscle. They will then go through a period called cutting, where they cut their calories to shed fat but expose the muscles that they have built. It's actually a bit of a science, and it takes some time and effort to really achieve. On specific strength training programs designed for women to put on muscle, at most she may put on 1 to 2 pounds of muscle a month. But what I want to make clear during this discussion about women and strength training is that it is actually a vital part of a woman's health, especially as she ages. No, I don't expect grandmothers or mothers to go out and lift heavy weights and injure themselves in the process. I'm going to make the distinction here between putting on muscle for bulky aesthetic purposes, to have big muscles, and the distinction to build overall muscle on a woman's body for her bone strength. I'll explain. As we age, we go through a condition called sarcopenia, and that is basically that our muscle on our body starts to diminish. This muscle requires more calories than fat to be active. So having more muscle on your body will actually help you burn calories and rev your metabolism and keep the fat at bay. Now that's a compelling enough reason typically for a woman who wants to put on a little muscle. However, that's not the angle I want to focus on. As women age, we are at risk of conditions called osteopenia and osteoporosis, which is basically step 1 and 2 of calcium depletion in your bones. Having osteopenia or osteoporosis puts you at a risk of injury and breaking bones the older you get. Resistance training, which can be even with just resistance bands, as long as it's challenging for your muscles, can help the process of bone remodeling to make them stronger in your golden years. That is also a very compelling reason to start lifting weights.